Well, this is just such a pleasure to be able to tell you today about the Betty Ann Stedman Nurse Residency Program at the Menninger Clinic, located in Houston, Texas, and currently ranked third in the nation by U.S. News & World Report for Psychiatry. We're also very proud that we're a Pathway to Excellence designated hospital designated by the American Nurses Credentialing Center. It's very exciting to me to be able to tell you about this program that's been in existence since 2005. It's designed to transition a new graduate into professional psychiatric nursing practice. A key component to professional development is to have some sort of an opportunity like this, and we think we have the most unique program of its type in the country. It's a 6-month program that is structured in a way that has building blocks totally precepted. And what I mean by that is that the preceptor works with the nurse every day during the 6-month period to ensure that that nurse gets individual training, preparing that nurse to be the best psychiatric nurse possible. But why listen to me when I've brought forward some of our top former nurse residents who can tell you more about it?
The transition from the graduate nurse role to the staff nurse role was easier and better than I could have imagined here at the Menninger Clinic. And I owe a lot to that to my preceptors. They really helped me develop and fine-tune my skills as a nurse, and they really modeled the professional nurse role for me on the unit, and I was able to observe them in their natural role. So it was easy for me to go from a graduate nurse to a staff nurse by the end of the residency, and I really felt prepared to be a professional nurse. The education days with Dr. Jane Mahoney were really crucial in my learning and also growing my skills as a nurse. We were able to present our clinical challenges every week, and that really helped me figure out what I was doing right in the clinical setting and what I could work on. Clinical challenges, meaning if I had an emotionally dysregulated patient, someone who was uncontrollably crying, really upset, really angry, and we worked on distress tolerance skills that I still use to this day with my patients. We did do role playing where Dr. J. Mahoney would be a patient and I would be the nurse or vice versa. And we learned about the distress tolerance skills such as, using the 5 senses to really bring you back to reality kind of and ground you. We talked about a lot of the DBT skills, the dialectical behavioral therapy. We did present a capstone project for our peers and our nurse managers, and we were able to teach it for a continuing education credit. It was over metabolic syndrome and how antipsychotics play a part in inducing metabolic syndrome in our patients. And that was really important for me, especially on my unit, the Comprehensive Psychiatric Assessment and Stabilization Unit. We have a lot of patients who take many different antipsychotics, and they do have metabolic syndrome. And so seeing what the best practice was for monitoring and preventing that was very important. I think everybody here at the Menninger Clinic, the staff nurses on every unit, the MHAs, our nurse managers, just everyone kind of played a part in supporting my learning and development as a staff nurse.
The idea of relationships is so important in the type of work that we do, given the length of stay here for the average patient. We really get to know the patient in an intimate way. And so relationships are important for them in the work that they do with each other, how we deal with them, and also the relationships that we have as staff with each other, because that provides us the framework and the support that we need to do the job. Maybe the most important relationship that we have here is the one with our preceptor, and it's certainly one of the earliest ones and the most formative and impactful. Right? You want to do as much as you can, as fast as you can, and what they do, I guess, in a nutshell, is really put a human face, a personal face on some of that structure that needs to be in place. And so we do so many things that are impacting people's lives. And to have a sense of the gravity of what we do is something that the preceptor can impart to us. And I didn't realize how difficult the job of the preceptor is until I had to do it myself and think about what it took. But they really have to keep you in mind, get to know you as a person, your strengths, your weaknesses, what makes you tick, how you learn best, and combine that personal knowledge with that framework, that structure, and sort of figure out how to place you and your progress within that structure. And also how to manage the relationship and keep you from getting frustrated because you want to leap ahead.
On our educational days, we would learn about different models of care, how we would think about patients. And one of them is the biopsychosocial spiritual model. So it's incorporating, biological aspects, psychosocial aspects like their family, how people grew up, and also spirituality and who they are as a person and what their interests are. I think it helps us ask some questions about what are some other things that are going on that are contributing to their symptoms. What are we missing? How can I think about my patient in a new and creative way? I really felt like that time that I had allowed me to kind of train my mind, like with my supervisor's help, to view patients in a broader way. I think in nursing, it's really important to not take things at face value. It's to look beyond like what's on the surface and to look deeper about what might be going on here. And I think Menninger really values that. And I think the nurse residency program gives us the opportunity to support that.
So the nurse residency, it did a great job in preparing me to professionally grow and really expand myself in the field of nursing. During the program, you have the great opportunity to really start expanding yourself and working on your professional development with great leadership and guidance throughout the program. In the program, you're presented with the capstone project, and with that project, you go from start to finish. You pick out a topic, you pick the points in that topic that you really want to focus on and hone in on. All the while you're doing research, you're collaborating with peers, collaborating with other members of the team. And throughout this process, you really learn what it takes to kind of engage in this kind of work. Only within 1 year, I was able to present at the American Psychiatric Nurses Association conference. This is the conference that, any psych nurse that's invested in the field, they definitely want to be at this conference. You have people from all over that are presenting ideas, presenting podiums, doing posters, doing sessions. And in this, I was able to actually take the evidence-based project that I did while I was a resident and actually present it to these same individuals. You start off with a great foundation that the residency does provide for you, and you're able to take all that, full confidence, full support. It's a big team effort, and you're presenting to, 100 or so people, what you've really invested in and what you had the opportunity to work on. The residency program, like I said, it's been great. It's putting me in positions to grow, as well as, helping those that come after me and really trying to give the same tools that was given to me for them to use for themselves.